It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physicians Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacy Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. So glad to have you joining us today. And we are going to have joining us good friend of Dr. Hotze's and colleague, Dr. John Wycoff, and he is going to be discussing a little bit about ozone and also ultraviolet blood irradiation, or UBI. Curious to know what that's all about. Dr. Hotze.
Thanks so much, Stacy, and thank each one of you for joining us today. You know, I believe that each one of you needs to have a doctor and a staff of professionals who can coach you onto a path of health and wellness naturally. So as you mature, you've got energy, you have vitality, and you got enthusiasm for life. I think what you ought to do every morning is look in the mirror and say, hey, I'm the most enthusiastic person I know. The way to be enthusiastic is to act enthusiastic, and it's contagious. It will rub off on your staff and your friends. And all of a sudden, everybody is pouring one another a cup of enthusiastic coffee every day. Well, I'm glad to be here with my good friend and longtime friend, Dr. John Wycoff. Dr. John Wycoff is a practicing physician in Michigan. I believe in Lansing is where you're located, isn't it?
East Lansing, yes, Steve.
East Lansing, which is the home of what, Michigan State? Michigan
State University, correct.
MSU. And so John grew up in Iowa and ultimately went off to osteopathic school in Kirksville, Missouri, and then did training and did his postgraduate training and ultimately set up a family medical practice in Michigan. And I've known John through the Pan American Allergy Society over the last 20-some-odd years or longer. When did you join Pan Am?
I think 1992, Steve.
It's been 30
long time ago.
It's been 30 years that we've been friends through about 30 years since we've been friends of the Pan American Allergy Society. And so John does natural approaches to health. Dr. Wycoff does, and he's got some very interesting therapies that he uses, IV therapies. But Dr. Wycoff, tell us about your journey. What made you decide to approach medical problems in a more natural fashion as far as treatment rather than pharmaceutical? I know if you're like me, in your training, you were trained to treat problems with drugs of some kind or surgery. You know, that was a disease model, and that's the way they trained us in med school. If you had a problem, there was a drug to treat that problem or at least ameliorate the symptoms of it. What in your career made you decide to turn to more natural approaches to health?
Well, Steve, thank you for the opportunity, and thank you for your long-standing friendship. You know, my journey to a less than conventional type of medicine started early on in my medical training. I was frustrated with my inability to get people with chronic illness better without prescribing potentially toxic types of treatments, whether it was medication or chemotherapy or radiation, that these types of therapies had a lot of different side effects for many people. And really, as you said, we were trained that there was a pill for every ill. And I really felt that we're missing something along the way. But that mindset is not something that was taught to us in conventional medicine, in medical school or postgraduate training. So my world evolved through Pan American Allergy, and with your help and assistance and many of our colleagues that we know and hold dearly to our heart, that there were ways to get people better with chronic illness without prescribing medications. And initially that was through the world of allergy, and understanding that allergy oftentimes accounted for chronic nasal conditions and sinus infections and ear infections and the like. And through that, I got into the world of bioidentical hormone replacement, looking at the importance of supplements in your immune health, And by looking at the immune health, I evolved into implementing two treatments, one called Ultraviolet Blood Irradiation, or UBI, and the other called Ozone, to try to help people's immune system improve and get them back on that road to health and wellness without taking pills.
And that's really a critical point that Dr. Wycoff does, and we do here at the Hotze Health and Wellness Center. It's so very important, and you know that now because of what's going on in our society, to have a healthy immune system. And for those of us that trained in allergy, like Dr. Wycoff and I have, we know that allergies, that's an abnormal reaction to normal substances that you may breathe in the air, like weed, tree, grass pollens, dust mite, mold, spore, and animal dander, as well as foods. Foods can cause allergy problems. They lead to oftentimes chronic nasal congestion and sinus infections, bronchial infections, asthma, and a host of other GI problems or skin disorders. But we think about the inhaled allergens. You commonly think about spring and fall allergies when you have the pollens out, and these cause people to have their immune system react abnormally and causes the certain cells they have in their body, mast cells, to rupture and spill histamine. That's why you take antihistamines. And then you've got the drainage. It's a culture media for bacteria. You get a bacterial infection, and you get on antibiotics. So both John and I, Dr. Wycoff and I, knew after seeing allergy patients that this really caused a problem in the immune system. And so in allergy, our goal was to get the load off the immune system so the immune system would be healthy and they wouldn't get recurrent and chronic infections and need antibiotics. So we're very attuned towards helping people build their immune system. And, you know, Dr. Wycoff, we've had this manufactured coronavirus. I like to call it a scam that they perpetrated upon the public. And when we hear the public health doctors, the government health bureaucrats, I call them, talk, we never hear them talking about what people can do to build up their immune systems, which is so, for us, is second nature. That's what we've been doing ever since I got into allergy for the last 30 years, is helping people build their immune system. By one, removing the toxic load of allergens and helping them not have abnormal reactions to allergens to take the pressure off, but also with vitamins and minerals and hormone supplements to help them build up their immune system. I wonder why it is. Have you noticed that when you listen to Fauci and these other folks on TV, whether they're local or national, they never talk about what people can do to build their immune systems up, as if it can't be done?
No, it's really sad that there is not any effort put in by public health officials to help educate people as to what they could do to take charge of their immune health and make it much less likely that they would ever get sick in the first place. I think it's a very sad commentary on where we're at as a healthcare system in this country.
You know, what I think, John, is happening, this manufactured crisis is causing, I think, a lot of people to become what we would term germaphobes, neurotic germaphobes, with this idea that in some way, if they can just keep away from germs, they can stay healthy. They're trying to take care of the germs on the outside, as if they could sanitize their lives and they wouldn't come in contact with viruses and bacteria, which is totally impossible to do, because every one of us, every day since we've been born, have come in contact with literally trillions of viruses and bacteria every day, and yet we're alive. And we're alive because we have a healthy immune system. Otherwise, we get sick, so we stay healthy. Overall, when our immune system's healthy, we stay healthy, and we don't have to worry about the viruses and bacteria. And that's done through several different methods that I want to talk with you about, John. One is, of course, vitamin and mineral supplementation. Of course, second is getting the allergy load off the system. But then there's some additional, and then replenishing your hormones, all of which you do at Wycoff Wellness Center there in Michigan, and we do here at the Hotze Health and Wellness Center. But there's some additional therapies that you taught us years ago that you use effectively and that we have used here at the Hotze Health and Wellness Center, which is the ultraviolet blood irradiation and the use of ozone therapy. So why don't we have you discuss UBI? UB as in boy, which stands for ultraviolet blood irradiation. What is that, and how does it work, and what is it used for? And is it some kind of new fangled idea that people have come up with? Tell us about everything you know about, educate us about UBI.
Okay, Steve. Well, thank you. Ultraviolet blood irradiation, or simply UBI, is really a cure that time forgot. This procedure was developed in the United States in the 1940s and 50s to treat chronic infectious disease like pneumonia, tuberculosis, and even used as an adjunct therapy for cancer. So this therapy has been in the United States for over 75 years, and it's used extensively in Russia and Europe even now for the treatment of many common medical conditions. So it's nothing that's really new, but what happened in the United States is with the advent of antimicrobial therapy, antibiotic therapy, through the 1960s, it became easier and simpler for physicians, for whatever reason, whether it's big pharma or whatever you believe, just to prescribe an antibiotic, have that prescription filled, and treat the infection. So things like UBI kind of fell by the wayside. Now, UBI is a little bit more of an invasive procedure. We have to gain access to a vein that usually involves a very simple step called a phlebotomy, where we put a catheter, a sterile single-use catheter, into a vein, typically the vein in the elbow, just like if you were going to make a donation of blood to the Red Cross or going to have a blood test drawn at a lab. They would put a little catheter, a little needle into the vein, usually in your arm. So we do the same thing here at the office. We do a phlebotomy or remove about 6 ounces of blood, 200 cc's, a small cup of blood, into a sterile bag. And then we can pass that blood through a device called our ultraviolet blood irradiation machine, where in essence the blood is exposed to intense sunlight in wavelengths ultraviolet A, ultraviolet C, and reinfused back into your body. So there's no drugs administered. The blood comes out. The blood is exposed to ultraviolet light, in essence sunlight, and placed back into the patient. The whole procedure takes less than an hour. And what the ultraviolet light does is it stimulates the cells in our body. And you can think of your blood having 2 main types of blood cells: the white blood cells, which help our immune system fight infection. Ultraviolet light stimulates certain types of white blood cells. We think they're called natural killer cells. So they're more effective at fighting disease. So if you're trying to fight off a skin infection or a bacterial infection or a viral infection or a fungal infection, your cells are more likely to be able to be successful doing that. Also, we have the red blood cells in the blood we take out, and the ultraviolet blood irradiation stimulates those red blood cells so that they carry more oxygen. And we all know that getting oxygen to your cells ultimately is a good thing. It gives you more energy, it stimulates healing, it reduces inflammation. So we get an effect on both the red cells and the white cells with UBI to help improve health and wellness, and we do it without taking medication.
So, Dr. Wycoff, just briefly, would you recommend that as a preventative therapy as well, since it has so many uses?
A great question. We have many people that we see who just feel that when they do UBI, that they have more energy, that their immune system works more effectively, and that they feel better. Maybe they sleep better. Maybe their aches and pains are less from their arthritis. But I use the therapy. I don't tend to get ill, seldom, and we have many patients who prescribe to that course of therapy, using it as a preventative therapy to try to keep them healthy. Now, we couple that with lifestyle measures, including diet and exercise and getting adequate sleep and taking the correct supplements. But UBI and even ozone, which we'll talk about in a little bit here, can be used to help keep you healthy and prevent you from getting sick.
So you're primarily using the UBI in your healthy patients to keep them healthy? And what percent of your patient population would you use this just to keep them in good health? And what percent would you be using it to treat underlying problems like maybe allergic disorders or arthritis or candida overgrowth or infections or eczema, psoriasis?
Being in medical practice and the nature of the beast is people typically come to see you when they're sick,
right,
or when they have a health problem. So getting people to buy into or consider something to keep them well is a little bit more of a battle. I would say about 80% of our patients we are seeing with a health problem. 20% of our patients are doing UBI or ozone therapy just to prevent illness, probably 4 to 1. But a significant number of patients we see who just want to stay healthy, and they're the people that are working on lifestyle measures, they're taking their vitamins and supplements, and they're using UBI and ozone as another tool in their toolbox to keep themselves healthy.
Now, with UBI, what would be the most common clinical conditions for which a patient would come to you and for which you would prescribe UBI therapy?
It's a good question. We've looked at this statistically wise. We probably see the largest number of people that seek out UBI initially for autoimmune illnesses, things like lupus, rheumatoid arthritis, psoriatic arthritis, Lyme disease. Those are oftentimes people that initially hear about UBI as an effective treatment and seek out our counsel regarding that option. We use it extensively as an alternative therapy in our patients who have cancer. So we build that into a comprehensive treatment program, which may include things like intravenous vitamin C, ozone therapy, supplementation, diet, lifestyle change, and the like. We also find a number of people with infectious diseases that will come to see us. Things like MRSA, that's a skin infection with a resistant form of bacteria. We've had just outstanding results with MRSA, and one of the nice things about MRSA, oftentimes people have a visible lesion or a sore on their skin and somewhere, on their face or their arm or their leg. And as little as 1 or 2 treatments, we'll be able to see that area will begin to dry up and heal. So it's very powerful for people to see that effect. So skin infections, bacterial infections, things like mononucleosis, shingles, other viral infections, we oftentimes see just outstanding results when we implement UBI or ozone as part of their treatment program.
And have you used this much in the treatment of psoriasis and had any good results with that, eczema or psoriasis?
Yes, any type of skin conditions, chronic skin conditions like psoriasis, which as we know is an autoimmune disease, eczema, even allergies. Allergies, whether it's food or pollen allergy, we do see a significant improvement in their symptoms. It's nice with people who have skin conditions for seeing a response. Right. They get such positive effect even after just a few treatments. We have an unusual patient right now we're seeing who had a very unusual problem with horseworms. And she had these pustules all over her face, arms, and legs. And we've been able to document with the help of a cell phone these horseworms actually coming out of her skin after she gets a treatment.
Oh, my
It's absolutely fascinating.
Very dramatic.
And, horseworms are almost unheard of in humans. They're reported. So we're hoping we can get enough evidence to actually have a reportable case report going on. But her skin complexion is just radically changed. She's had 3 or 4 treatments over the last month.
I was going to ask how many treatments.
She's on about her 4th or 5th treatment right now. But even just after a couple treatments, she showed us this video. It's just amazing, of this worm coming out of a pore on her face. It was about 1 inch long. We sent it off to have it analyzed. I said, I don't even know what this is. And it turns out it's a horseworm. And the pathologist said, this is not from human origin. I said, well, but I saw it come out. And so it's really fascinating. But people with chronic rosacea, eczema and psoriasis, as you mentioned, with the lupus rash, MRSA, any type of visible infectious type skin lesion with herpes zoster or shingles, we see that begin to dry up and improve just after 1 or 2 treatments. So those kind of results are always very gratifying, both for us and the patient.
And your treatments would be in a patient. Would you do it initially twice weekly, or once
Sure.
weekly? What do you recommend?
We customize, all our patients are seen by me, and we customize a treatment program. We are comfortable doing treatments as often as every other day.
Right.
So occasionally we have people come in every other day for a week or two. Twice weekly, if someone's ill, is a pretty common starting point. We tend to find that UBI builds on itself, so the more treatments you've done, you can begin to back down the frequency of therapy or treatments, and you still will have the effect.
Right.
So we may start out with a course of 10 to 15 treatments twice weekly, then go down to once a week, then maybe once every 2 weeks, and once a month. It really depends on how the patient responds and how sick they are to start off with.
Great. Now, tell us about any potential problems that you could have with this treatment, or are there any?
Well, I think with any treatment, you have to educate and screen your patients. The most serious potential problem with UBI and ozone therapy is if they have a hereditary disorder called G6PD deficiency. That is a very uncommon problem. It's really seen in people who have a strong Middle Eastern or African ancestry. Oftentimes, patients don't know they have the deficiency, may not have any symptoms. So we screen our patients for G6PD deficiency by history, and also if we have any concern, we do a very simple blood test and we measure G6PD level. It is very, very rare, and we've done thousands of tests. I think I have found 2 or 3 patients who have G6PD deficiency. So that's really the only absolute contraindication. People that have an iron overload problem called hemochromatosis, we usually don't treat with UBI. We don't tend to treat patients who are pregnant or nursing. There's no absolute reason we could not, but we feel it's in the patient's best interest not to treat them if they think they may be pregnant. So those are probably the real only medical contraindications. In terms of problems with the procedure, occasionally there's some bruising where the IV access point is obtained, maybe a little soreness. You can get a phlebitis, inflammation of the vein. Occasionally there'll be some mild hemolysis, especially in G6PD patients, so they may get some blood in the urine. But and occasionally they may get some die-off. If they have really significant systemic infection throughout their body, they may feel some fatigue, almost like a Herxheimer reaction, a reaction you get initially when you're on an antifungal or an antibiotic as the organism begins to die off. So those things happen. They're very manageable with either just supportive therapy or assistance from our office, but our percentage of patients who have any problems at all, very, very low, far less than 1%.
Right. So basically, the treatment of a host of medical illnesses using ultraviolet blood irradiation offers a great opportunity to help people get healthy and well using a natural method of using the UBI treatment to kill off the bacteria or destroy the abnormal reaction that people have, and it stimulates a healthy immune system. And so is there any reason why other conventional doctors don't use this?
I think it's unfortunate that more physicians don't understand that optimizing your immune health is really the key to almost all chronic disease. You and I understand that almost all chronic disease involves some dysfunction of the immune system. It may play out as an autoimmune condition. It may play out as allergies. It may play out as chronic digestive issues, but anyone who's got ongoing chronic disease has immune system abnormalities almost by definition. So if you can begin to at least entertain or accept that premise, then it only makes sense. What can you do to improve the immune system's ability to heal? And that involves getting patients motivated to look at diet, exercise, sleep, supplementation, and then things like UBI and ozone to incrementally improve how their immune system responds to the insult they're under.
Well, let's talk about ozone therapy and how, and this is another, but remember, the UBI therapy is intravenous, as is ozone therapy. So let's talk about ozone, which is a form of oxygen. Why don't you explain ozone therapy and what it does and how it stimulates and improves the immune system?
Well, ozone therapy is a newer therapy for Wycoff Wellness. We're in year 4 of our ozone ozone treatment. And really, it's a natural evolution from ultraviolet blood irradiation. Dr. Schallenberger is kind of the guru of ozone therapy, and I was trained by Dr. Schallenberger years ago. And he was and still doing ultraviolet blood irradiation, but added ozone as an adjunct to UBI treatment. And that's really how we use it at Wycoff Wellness. So what ozone is we're able to take ozone, the same ozone that you would find in the stratosphere, in the air we breathe. Ozone is formed when sunlight hits oxygen in the atmosphere. Oxygen is O2, 2 oxygen molecules bound together by a strong double bond. You expose that oxygen to intense sunlight up in the stratosphere, it breaks into 2 singlet oxygen molecules. Some of those molecules will reform into 3 oxygens instead of 2. O3 is ozone. And for your listeners, ozone is easy to think about. If you've ever had a rainstorm or lightning storm, and right after the storm you kind of smell that spring rain smell or that fresh rain smell, that's ozone that was made from lightning in the atmosphere and was brought down by rain. It's that fresh smell, the fresh rain smell. That's ozone. That's what it smells like. So what we're able to do is we have a device that makes medical-grade ozone. We have medical-grade oxygen in a tank. We expose it to electricity. The electricity splits the oxygen into singlet O's, and some of that reforms as O3. The O3 is stable for about 20 to 30 minutes. Then it wants to revert back to O2 and a singlet O. So we can draw that gas up, and we can administer it to the body many, many different ways. The only way we don't administer it is we don't breathe it. Ozone is toxic to the lungs, can really promote or cause bronchospasm like an asthma attack. So we don't breathe the ozone. So we take the ozone and we put it into the blood just before we do a UBI, and then put that ozonated blood through our ultraviolet machine back into the bloodstream. And it's really amazing. As you take venous blood out of the body, it's usually kind of a dark maroon red color. You know, it's a deep red, deep maroon, dark red color. We add the ozone with a syringe, use the equal amount of ozone to equal amount of blood. So if we have 6 ounces of blood, we'll add 6 ounces of ozone. We can vary the concentration. The blood within 2 minutes will become a vibrant red, much like the color of a stop sign.
Yes, it's like
Right
this
in
bright
front-
cherry
right in front
red.
of your eye.
Yeah. It's very dramatic.
Absolutely amazing.
And of course, that's the oxygen attached to the blood.
It's exactly right. It is hyper-oxygenating the blood. And that free O that is split off from the O3 as it goes to O2 and a single O can penetrate into the cell and affect how the mitochondria is making energy. So, and we know that oxygen stimulates healing. So we can take this highly oxygenated blood, put it back into the body. We can do it with UBI or without UBI, and we can stimulate a response of the immune system, and we can improve a response of oxygenation all through the body, because your blood goes all through. It goes to your brain, it goes to your heart, it goes to your muscles, it goes to your bones, to your gut. So all those areas are going to get the benefit of having a shot of oxygen in a very concentrated form.
Well, tell me how you do that with UBI. Will you draw the blood out, put it in oxygenated, and then run it through the UBI and put it back in?
Exactly right. Before we start the reinfusion of the UBI, after we've done the phlebotomy, the technician will go into our room where we make the ozone. We have a room with our ozone machine and our oxygen tank, and she'll dial up the concentration that I prescribed for the patient. We have a protocol, like everyone does, as to what concentration of ozone we start. And let's say that we've done a 200 ml, or 200 cc phlebotomy, which is typical for an average-sized adult. We'll drop 200 cc's, and let's say we're using 60 gamma. Gamma is a concentration of ozone. So she'll drop 200 cc's in syringes, usually 60 cc syringes, large syringes. So she'd have 4 of those syringes with a total of 200 mLs of ozone gas. Ozone's heavier than air, so we just put it in the syringe, turn the syringe upside down, carry the syringe into the room where the patient is, put a needle on the end of the bottle through the IV bag, and we just insert the gas, and then begin to gently agitate the mixture in the IV bag of phlebotomized blood and ozone. And then you'll see that color transformation occur just in front of your eyes. Some patients will have them actually hold the bag of blood in their hand and just kind of move it back and forth from hand to hand very slowly. And it's very powerful for them to see that just this slow agitation and mixing of venous blood with ozone, the change that it has in the color. Mm-hmm. And then we reinfuse the blood. Simple as that.
And so you like to use this in combination with your UBI treatment?
We can. And I talked to Dr. Schallenberger about this. He really has moved almost entirely to ozone alone therapy, and because it can be done much quicker than UBI ozone. We have some patients who do ozone alone. And to be honest, for me personally, I typically just do ozone alone because I can do an ozone infusion in 20 minutes. It's simple to do. With what we call MAH, major autohemotherapy ozone. That's the intravenous ozone. A number of our patients feel that they get better results doing UBI with ozone. So we have the option. We can do UBI alone, ozone alone, or UBI plus ozone. The other thing with ozone, which we use in some patients, is we can take ozone, and as crazy as it seems, we can apply that ozone gas into a bag and administer it via rectal insufflation. A small little catheter inserted into the rectum, and we push about 200 cc's of ozone into the colon. And as you know, the colon, the mucosa, or the lining of the colon, has tremendous blood flow, and we get great absorption of ozone right into the bloodstream through the colon. So that's another way to administer ozone. People don't always enjoy having a catheter into their rectum, but it's actually very efficient, very effective, and it's actually much more cost-effective to do what we call rectal insufflation, RI ozone. We can also put ozone into, if you can imagine, a stethoscope with the diaphragm or the end of the stethoscope cut off. We hook the ozone machine into the stethoscope, put the 2 earpieces in, and just insufflate ozone into the ears. Through the tympanic membrane, you can get absorption of the ozone to help with people with chronic sinus issues or even an acute upper respiratory infection. So there's some patients who elect to do the oral ozone, AURAL ozone. It's another effective way. Or I can take ozone in a syringe, and I can do an intra-articular or into the joint injection. We can just put a little anesthetic, a little procaine, maybe a little bit of depomedrol, and then I can inject 10 mLs of ozone right into a knee or a hip or an elbow for people that have acute bursitis, tendonitis, arthritis, and the like, and get almost immediate improvement of their symptoms.
That's fascinating. You may know, you may be aware that we do stem cell exosomes here. And one of the ways that you can treat someone with a joint disorder, with chronic joint disease, degenerative joint disease, or osteoarthritis, is using the stem cell exosomes with platelet-rich plasma and Wharton jelly, and adding the ozone therapy on top of that, which is a wonderful combination. So,
without a doubt, the adding the ozone to the PRP is a great idea. There's just no downside to it for the majority of patients. Very, very safe, very effective, and that oxygen administered from the ozone will get into the mitochondria and begin to stimulate a healing response.
Well, Dr. Wycoff, thank you for your very articulate and simple way you've explained both UBI, which is ultraviolet blood irradiation, and ozone therapy as modalities that you use, that we use here at the Hotze Health and Wellness Center to help people overcome diseases when they have a disease, and it helps stimulate the immune system, and also it helps regenerate and rejuvenate the cells in the body, because the cells need oxygen. And if you can get oxygen, more oxygen into the mitochondria, which is the power plant of your cell. All of us have power plants in our cells. And if you remember biology, the power plants are called mitochondria. Some cells have one mitochondria. Others have thousands, like the heart cells, because they need a lot of energy. And the energy that's produced is electrical energy. So we all are a bundle of electrical current, and we want you to be, and each one of our guests, we want you to be a high energy, high voltage individual. To do that, you've got to have good energy production of electricity within your mitochondria, within the power plants. And these are two methods that are helpful to do that, particularly when you're having some health problems, health issues, is using ultraviolet therapy on the blood and using ozone therapy. So, Dr. Wycoff, I appreciate you sharing this and teaching us about this several years back. We've used it effectively here. I know you found it to be very effective in your practice. And for any of you individuals in our listening audience that have got some chronic conditions that your conventional doctors just don't seem to be able to help you with, despite all the drugs you've been giving, oftentimes when you take those drugs, you get sicker quicker, and there's really not a pill for every ill. That's not how people aren't sick because they have low levels of pharmaceutical drugs. These are two modalities that you need to consider and that we offer here. If you happen to be in proximity of Dr. Wycoff, of course, you can see him at his office there in Lansing, Michigan. Now, Dr. Wycoff, tell us how any individual could get in touch with you, find more information about your Wycoff Wellness Clinic in East Lansing.
Thank you, Steve. A lot of information on our website. We've tried to make the website interactive and informative. It's Wycoff Wellness, WYCOFF wellness.com. A ton of information there, videos and the like. Certainly can call our office, 517-333-7270 or 800-471-0255. My staff is motivated and educated and happy to kind of walk you through what we do and help get you started on that road to health and wellness naturally.
Thank you for the great work that you do.
I do appreciate that, Dr. Wycoff. And as we get over this crisis, Janie and I need to make our way up there to visit with you and Cindy, and I want to take that boat trip across the lake that you promised.
Well, it would be a privilege to have you up here, and hopefully we'll get through this. We will get through this coronavirus. I call it a hoax, too, and things will get back to some degree of normalcy, hopefully in the next few weeks. So God bless you and all the great work that you do in Texas, and keep fighting the fight.
We'll do that. Dr. Wycoff, thank you again for joining us.
You're welcome. You guys have a great day.
You too. And for all of you out there who want to find out more about our center, you can always call us at 281-698-8698. That's 698-8698. Dr. Hotze also spoke about some great supplements that you can take to boost your immune system. So you can always go to our vitamin website, HotzeVitamins.com. That's HOTZE, vitamins.com. Thank you for joining us here today at Dr. Hotze's Wellness Revolution.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.